We are asking schools to plan to provide full-time instruction in person for all interested students with the following health and safety measures in place. The first one we know works really well: universal and correct use of face coverings in the school community, promotion of hand washing and respiratory etiquette, ensuring healthy facilities with ventilation, cleaning, and infection control plans, and then having a plan and being ready to respond to cases of COVID-19 when they happen. And that includes reporting to public health. It includes contact tracing, communicating with your staff, families, and school districts, as well as supporting students who need to receive instruction and are excluded from school due to illness or quarantine. In addition to those mitigations that I mentioned previously, physical distancing is recommended, and schools should have two plans in this regard. One that factors in the recommended physical distancing of 3 feet in classrooms and 6 feet elsewhere to the greatest extent possible and reasonable, while providing full-time in-person instruction for those families that want it. And then schools should also have a plan that does not have a physical distancing requirement. And this is, partly because we are pretty far away from the school year in terms of pandemic time. So we're asking schools to have both of those plans, and we will keep them posted over the summer as we monitor the science and course of disease and vaccine uptake in our state. COVID-19 testing programs and vaccinations are additional layers of prevention that we recommend in schools, but not a requirement for providing in-person instruction at this time. These measures do greatly help reduce the risk of transmission in schools and in the broader community. DOH has a testing program called Learn to Return, and it was recently expanded with funding from the Centers for Disease Control and Prevention. This program provides schools with a menu of options to support testing in or near their school campuses. That includes responsive testing for people who have symptoms or are close contacts of someone with COVID-19, as well as repeat testing, also known as screening testing, or surveillance testing. We work one-on-one with districts to really meet them where they are in terms of their school and community needs and capacities in this regard. We are currently supporting more than 100 school districts across Washington state with COVID-19 testing, and we continue to expand both the number of districts and the types of tests offered. So, any district that is interested can reach out to DOH, and we will be glad to help you with testing this year or plans for the summer or fall. I'm going to wrap up by saying, schools play such a key role in child and family well-being. They are foundational to child growth, development, learning, and health. And we've learned over the past year that schools are very good at implementing these health and safety measures, which limit transmission and protect the students, staff, and their families. We're really excited that the 2021-2022 school year can look a bit more normal, and that Washington's children have the opportunity for full-time in-person instruction. It is also important to note that a remote option will be available to those families who need it. We have the opportunity for full-time instruction largely because of these health and safety measures and because of vaccinations and their incredible ability to protect individuals and our communities from disease. As you heard from Dr. Shaw, we strongly encourage families to get their children vaccinated for COVID-19 as soon as they become eligible. And we encourage schools to work closely with local public health and vaccine providers to help families in their community, students and staff, receive the vaccine and get protected over the summer. Every single person is a step forward every single person who gets vaccinated is a step forward on our journey to recovery from this pandemic and gets us closer to a more normal school year next year. Back to you, Corey.